Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal Sentinel.
Okay. Hi, I'm Louise Lyle, and I just graduated from UW-Madison. They asked me to come here today to talk about what I care about for my healthcare. And for me, access to healthcare is really about autonomy and choices. I'm 22, I'm a recent college graduate, I'm just starting my career, and on top of those things, I'm a woman. In different circumstances, a lot of things in my life would have been decided for me, but I'm fortunate to have parents and grandparents who supported my decisions to have a family or not have a family, have whatever kind of career I want, and to decide when and how many children I want. I remember when I was in middle school, I was sitting in the kitchen with my grandma and some of her friends, and they were reminiscing about their youths and thinking, and one of her friends commented that she just wished she could have decided how many kids she wanted. And my grandma, who had 11 pregnancies, chimed in and said, and when? And as a 13-year-old, these were things I really took for granted. Now, as a young woman, I know that my copay-free birth control keeps me from second-guessing so many decisions that I've made. It allows me to have individual life goals and career goals beyond having a family. Schimmel, Walker, and the Republicans don't agree that my autonomy is important. They cut funding for essential healthcare services like breast cancer treatments and screenings. They fly to crisis pregnancy centers, and they've supported policies that limit abortions even in cases of rape and incest. These are policies that would force women to give birth and robs them of the opportunity to make choices about their careers, their finances, their health, their bodies. Coming from the party that claims to support individual liberty, this is a serious infringement on my autonomy and the autonomy of all women. Therefore, we should give our votes to people that support our ability to make basic decisions about our own health. So therefore, for that reason, I'm going to be giving my hard-won vote to a Democratic slate that supports my autonomy, that believes in my rights, that fights to preserve my freedom, and allows young girls across Wisconsin to imagine the future that they want. And now we're going to be hearing from Representative Lisa Subek. Thanks.
Thank you. I'm going to try not to mess up anyone's microphones here as I put my papers down. So I'm State Representative Lisa Subek, and during my time in the legislature, I have seen the extreme barriers that Governor Walker has created. He has made it harder for women to access safe and affordable comprehensive health care. For the past 7 years, Governor Walker has left women behind. Governor Walker has been making health care decisions for us and about us, but without us and without our consent. Shortly before I joined the legislature, Governor Walker stripped more than $1 million of funding for women's health care, forcing 5 rural healthcare clinics to close, and leaving women in those rural communities without access to needed care. And since then, it's gotten worse. Governor Walker has been at war with women, attacking everything from equal pay to programs that support low-income families, and from support for working mothers to reproductive health care and access to birth control. The attacks go on and on. As a legislator, I have worked really hard to make health care for women more available and more accessible. Working to create spaces for working mothers to breastfeed, I've worked to make birth control more accessible for women in rural communities and low-income women. And with my Democratic colleagues, I've worked to ensure that every woman can receive medically accurate information when making life-changing personal medical decisions. The simple fact is the Wisconsin women should be trusted to make our own decisions about our health care without interference from politicians like Governor Walker. And women should be treated fairly and equitably, whether we are working, going to school, or raising families. Wisconsin women deserve a governor and a lieutenant governor who will stand up for us, who will have our backs, regardless of whether it's politically expedient. We need a change, and Tony Evers and Mandela Barnes will be that change. That's why I'm proud to be here today to be able to introduce to you our next Lieutenant Governor, Mandela Barnes.
So thank you, Lisa. Thank you, everyone, for being here with us today. I am Mandela Barnes, running for Lieutenant Governor, former colleague of Representative Lisa Subeck. And we fought some of these fights on the assembly floor in our short time in the legislature. And it continues a dangerous trend of limiting access to women's reproductive health care coverage. And it's a problem because the governor and the legislature never seem too concerned with babies after they're born. And you look at the rate of child poverty here in the state of Wisconsin, it's a disturbing problem. You also look at the fact that women still don't earn the same pay as men in the state of Wisconsin. The legislature has failed to act. The governor has failed to act. But what you will have in a Tony Evers, Mandela Barnes administration is one that puts the rights of women forefront, right, front and center. What you will have in the administration is one that cares about the economic security of women as well as the health security of women. Governor Walker and the legislature is, Mike Pence is in town today, I believe, who has been the #1 villain to women's health. And it's sort of a race here in the Midwest to see who can be the most extreme, who can be the most dangerous. And it's a deadly game that is being played with women's lives, and it needs to end now. That's why I'm standing here. That's why I want to make sure that people across the state understand what's at stake. Because, again, it is not just about women's health, it's about women's economic security. It's about just the livelihoods and treating people as humans, which the governor has had no interest in doing for a very long time. So aside from the defunding of women's health centers in this state, besides the dangerous 20-week abortion ban, regardless of medical situation, the governor has gotten it wrong. And it's time that the state gets it right. It's time that we turn the clock. It's time that we move forward instead of backwards on this issue. So again, I want to thank you, Representative Lisa Subeck. I want to thank you all for being here. I want to make sure that we do take a moment for a few questions.
Do a gaggle this way?
You want to do a gaggle that way? Nope, that means I got to go that way.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal Sentinel.